Hello and welcome to Local Doctors on Call. I'm Alex Redmond. Do you or someone you know need a mommy makeover? If you have children, then the answer is probably yes. Childbirth can wreak havoc on your body, and during the 9 months of pregnancy, even the leanest, strongest, and fittest will be stretched, pulled, and prodded beyond recognition. A small portion of our population are able to get back into pre-pregnancy shape, and that's usually due to genetics or other factors, like devoting hours of working out with a personal trainer. But for most of us, the symptoms are either deflated or enlarged breasts, excess skin around the abdomen, and excess fat. The mommy makeover procedures usually involves a trifecta, and here to tell us all about it is Dr. David Mobley of Sarasota Plastic Surgery Center. He is board certified by the American Board of Facial, Plastic, and Reconstructive Surgery. He's also a member of the American Society for Aesthetic Plastic Surgery. Welcome back, Dr. Mobley.
Great to be here.
It's good to have you back. So there's a lot of mommies out there and people that know mommies that are going to be very interested in this, because after you have a child, your body takes on a life of its own, and getting it back is not easy. So what is a mommy makeover?
Well, it's a very exciting group of procedures if you're a mommy who hasn't been able to get rid of all the changes related to having a baby and being pregnant. And most of those centralize around what you just mentioned, which is gaining fat in certain storage areas like the hips or thighs, and then excess skin left over from being pregnant and the stretching involved. And then sometimes changes in the breasts, either they droop afterwards, or you lose volume, or you may even gain volume. So all three of those are common problems, and the mommy makeover is designed to address all three of those and to correct all three.
All right, if you'd like to call in with a question, our phone lines are open now, and the number is 361-4675. 361-4675. It is a great opportunity to call in and speak directly to Dr. David Mobley. Okay, what procedures are involved in this? You talked about inflating the breasts or doing a breast reduction, tummy tuck. What are they?
Starting with the breasts, it really depends on each mommy, as you might say. Some patients come in with loss of volume, so you may do a breast augmentation or breast enlargement as part of that trifecta, as you mentioned. Some patients come in with large pendulous breasts that droop, and so a breast reduction would correct both of those. And so that would be step one. Step two would be to correct the abdominal changes, which usually involves a tummy tuck or sometimes liposuction of the abdomen. And then the third part of that trifecta is liposuction of the bulges that commonly occur on the hips, outer thighs, and inner thighs. So when you combine those three, that's essentially a mommy makeover.
Now, what about people that are concerned about the safety aspect? Because in the past, we've heard that liposuction and tummy tucks can be dangerous. What makes them safer now?
Well, the procedures themselves can be performed together for a couple of different reasons. One is anesthesia for that period of time is much safer. The anesthetic agents are lighter, they're out of your system sooner, and so going under anesthesia for 3 to 5 hours is not as dangerous as it once was. In fact, I would say it is much, much safer than it used to be. And then the pain control after these procedures is much better than it used to be. So we can combine these procedures without it being as painful, and so patients can get up and move around right after the surgery. They're not in the pain that they were in the past, say after a tummy tuck. So we use these special devices called pain pumps, and those drip anesthetic into the abdomen during the first 3 days after the surgery, and they make the tummy tuck much less painful. And so that's changed everything, really.
Is that something that the patient actually is able to control themselves when they're at home, or is that something that is pre-timed?
It's all automatic. It's all automatic. It just happens on its own. We put it in the operating room, and it controls the pain for the first 3 days.
Wow, so it's like taking a time-release
Right,
capsule
exactly.
of something.
Right.
All right, if you'd like to call in with a question about mommy makeovers or breast augmentation, liposuction, tummy tucks, all of the above, our phone number is 361-4675. 361-4675. We'd love to hear from you, so don't be shy. Pick up the phone. Why is it important to see a board-certified plastic surgeon? And while you're answering that, we're going to bring up that graphic that we have so people know what to look for.
Well, I think when you start doing procedures like these, where you're counting on the surgeon being very adept at several different procedures, and they're going to be performing surgery on your breast, abdomen, and the rest of your body, you really want to have somebody who is extremely well trained and has done a residency in plastic surgery. So if you're seeking a board-certified plastic surgeon, they would have done a full and complete residency in plastic surgery. In addition, they've passed their plastic surgery boards, which means they've proven that they're highly competent in that area and that they understand not only the surgery, but safety procedures. And if you were to have any problems after the surgery, they know how to take care of those too. And I think this is a final important point. They will have hospital privileges, and other doctors that aren't board certified may not. So if the worst case scenario occurred and you needed to be admitted to a hospital, they could take care of you there too, whereas some doctors doing this same procedure do not have hospital privileges.
And there's a certain graphic that we're supposed to look for, correct, when we go to one of these hospitals?
Right.
We're going to go ahead and bring that up, and you can tell us what this is about.
Yeah, this is a graphic that indicates you are a member of the American Society of Plastic Surgeons. And American Society of Plastic Surgeons, in order to be in this society, you have to be a board-certified plastic surgeon. And I know that's hard to remember all of those words, but if you just look for that graphic, it looks like a circle within a circle. That's an easy way to identify a board-certified surgeon.
All right, if you'd like to call in with a question for Dr. David Mobley of Sarasota Plastic Surgery Center, we'd love to hear from you. Our number is 361-4675, 361-4675. And Jewel is on the line. Hi, Jewel. Welcome to the show. What would you like to ask the doctor?
Thank you. Is it possible to have your breasts lifted without having anything added inside them?
Yes, it is. That we call a mastopexy, and that's our big medical word for a breast lift. And we do those on a regular basis, so you can have your breast lifted and everything centered and the nipple placed in the proper position, and even have some tissue taken away from the breast if they're too large, all at the same procedure. So that's called a breast lift or mastopexy.
All right, thank you for your question, Jewel. And if you have a question, call 361-4675, 361-4675. Dr. David Mobley is answering your plastic surgery questions. It's great. Now, let's talk a little bit about prices on the internet. We see prices on the internet. Come on in for a great deal on breast augmentation. Come on in for a lunchtime lipo. What's that about? Is that something that people should even consider getting, or is there a red flag?
Well, I think, first of all, you don't want to be shopping for the best deal when it comes to your health and safety. I certainly think it's okay for you to look for pricing among well-qualified surgeons that are board certified. Some do offer better prices than others, but you'll also see the unqualified surgeons offering extremely low prices that almost don't make sense for that group of procedures. And if they don't make sense, there's a reason why they're able to keep their prices that low. Either they're not operating in a facility that has the same qualifications as ours does, doesn't meet the standards of the Agency for Healthcare Accreditation. So essentially they're operating in an office setting instead of a hospital setting.
How do you know if they're qualified or not?
It can be very difficult. It's almost easier to know who is a board certified plastic surgeon by looking for the symbol that we mentioned, and because all board certified plastic surgeons must operate in a in a credentialed facility. They must operate in a facility that has standards. So they have to prove that to our society in order to be part of the American Society of Plastic Surgeons. So that's one easy way, is to just look for doctors who are in the American Society of Plastic Surgeons and have that double circle logo. It's sometimes very difficult for the consumer to know who doesn't have that, because they can easily be fooled by very majestic sounding credentials that are similar to the ones we have. And you have to be very careful. Do your homework, make certain that you're dealing with a board-certified plastic surgeon, and people will attempt to fool you, unfortunately.
All right, Dr. David Mobley is answering your plastic surgery questions, and we're talking about mommy makeovers as well. Call 361-4675, 361-4675. And now we have Janice on the line. Janice, welcome to Local Doctors on Call. Go ahead with your question.
Hi, Alex. My question is, you hear about this hot liposuction where they actually heat the liposuction? Are you familiar with that? And is that the kind you perform? And also, there's also talk about freezing liposuction. Thanks.
Right. There are a number of different types of liposuction available today, where you use some form of energy, either heat, ultrasound, laser, or cooling, to try to increase not only the effectiveness of the liposuction, but also get the skin to tighten. At present, none of those has been proven to work that well. We haven't adopted any of them yet because we're still waiting to see which one rises to the top. I always tell my patients, once you see me doing it, you'll know it's a legitimate procedure. Until then, I would hold off. Traditional tumescent liposuction probably is still your best alternative. It's still the safest. We know the most about it. You're least likely to have problems with it. Anytime you add energy to liposuction, there's a possibility of more complications. Until that gets worked out, it's probably a year or two away. I would stick with tumescent liposuction for now.
All right, Janice, that was a really great question. And if someone out there has a question, go ahead and call us. It's a great opportunity to speak to Dr. Mobley without making an appointment yet. Our number is 361-4675, 361-4675, and he'll answer your questions when we come back from break. Please stay with us. Welcome back to Local Doctors on Call. I'm Alex Redmond, and Dr. David Mobley of Sarasota Plastic Surgery Center is answering your questions about mommy makeovers, but that includes tummy tucks, breast augmentation. It also includes liposuction. And if you'd like to call in with a question, our phone lines are open. Call 361-4675, 361-4675. We'd love to hear from you. And Dr. Mobley, we're talking a lot about the procedures themselves, but how do you pick a safe facility? Because I would imagine that nowadays that must be very important.
Well, I think you can separate facilities into two types: those that are certified, that actually have the necessary emergency equipment to take care of you if you had a complication, and those that are office type facilities. And so often less qualified surgeons will operate in an office type facility because they can't meet the qualifications to be in a hospital setting or in an outpatient surgery setting. So that's one thing to look for, is to ask the doctor, do they have hospital privileges? If they don't, that should be a red flag, because if they are a well-credentialed and well-trained surgeon, they should be able to go to a hospital and perform the same surgery there that they are on you. So that's a big question to ask. Secondly, you can ask if they are certified by AHCA, or there's another longer one called quadruple ASF, and both of those are certifying entities that say that this is a safe facility to have surgery in. And so ask the doctor if they're in a certified and credentialed facility before you have surgery there.
All right, our phone number is 361-4675, 361-4675. We are live tonight And we have Mary on the line. Welcome to the show. Go ahead with your question, Mary.
Thank you. My question is, would any of these procedures be covered by insurance? And if not, what is the average price?
Okay. No, none of these are covered by insurance because they're designed to take care of cosmetic problems. On occasion, the breast reduction for large pendulous breasts that cause back pain, neck pain, and shoulder strap gouging are covered by insurance. So I guess that would be the one exception. And so the reduction of the breast can sometimes be covered. Costs vary from several thousand, from the $6,000 to $7,000 range up into the $15,000 to $16,000 range, depending on which procedures you do, whether you do one of the procedures or all three. And the costs are less than they are when you do those procedures separately. So you do save money by combining the procedures. Also importantly, you save time in recovery because you're only recovering once instead of 2 or 3 times.
All right, our phone number is 361-4675, 361-4675. And now we have Nita on the line. Hi, Nita, welcome to the show.
Hi, I know your subject is really mommy makeovers, but, and I, haven't been a mommy, and I mean, I'm still a mom, but, I had my babies quite a while ago. I mean, I guess an appointment is really the only way if you can see if you're an actual candidate for some of these procedures, like a tummy tuck, for example. And how expensive is that? I know that you were just mentioning some prices, but I think that was for breast reduction. So I was wondering what a tummy tuck was involved and what the recuperation time is on something like that.
Right. The common way that patients find out if they're a good candidate is to come in and see me in the office, and they can explain what their concerns are, and then I can examine them and tell them whether they're a good candidate for the surgery. I think that's the best way to do it. On occasion, we have patients who call in to Cheyenne, my office administrator and patient care coordinator, and they will send images through email, and we can give them some idea of whether they're a good candidate for the procedures based on those images. So that can be an initial way to do to find out some information on whether it's a good idea for you to come in for the consultation. And then cost-wise, an abdominoplasty or tummy tuck by itself is approximately $7,000, and it depends on the length of the surgery and anesthetic time and things like that. So somewhere between $7,000 and $8,000, I think, is a good ballpark for that procedure. If you want exact costs, you can call our office and find out the exact cost of the procedure.
All right, Nita, thank you for your phone call. And if you'd like to call in directly to Dr. David Mobley's office, which is Sarasota Plastic Surgery Center, the number is 366-8897. Again, 366-8897. Or go online. It's very simple, sarasotaplasticsurgery.com. And you guys are right here on 41, so easy to get to.
Yeah, just up the street. And we're right on 41, easy to see, just south of the hospital. So.
We talked about the facility. Let's talk about the anesthesia, because you were talking about how it's safer nowadays. Right. Years ago, people were very concerned about getting tummy tucks and liposuction, and we talked about how that's changed a little bit. But the anesthesia itself, how has it changed?
Well, the anesthetic agents are much shorter acting than they used to be. And so they, once they go into your system, they cause you to be anesthetized for that period of time you're having surgery. And then once you wake up, they go out of your system much more quickly than they used to. And the toxicity associated with the anesthesia in the past is much, much less than it used to be. So the risk of them causing some problem health-wise is almost negligible now. In fact, we really think general anesthesia is probably as safe as twilight anesthesia in this day and age because the agents are so much better.
All right, if you'd like to call in and speak directly to Dr. David Mobley of Sarasota Plastic Surgery Center, it's your opportunity. You may call 361-4675, 361-4675. We will take your questions when we come back from the second break, so please stay with us. We'll be right back. Welcome back to Local Doctors on Call. I'm Alex Redmond, and Dr. David Mobley is answering your questions about mommy makeovers, liposuction, breast augmentation, and also tummy tucks. And Judy's on the line. Hey, Judy, thanks for calling in. What would you like to ask Dr. Mobley?
Hello, Dr. Mobley.
Hi.
I have had a hernia surgery on the left side of my tummy.
Right.
And this was about, 7, 8, 10 years ago maybe. But the right side of my tummy is nice and flat. However, the left side has got a bulge in it. Is there any way that you can take out the bulge and have that side flat too?
Yes, you can reinforce the other side and improve the contour, and that would be done with an abdominoplasty, so that could be corrected.
Great, thank you for your phone call. And we also have some photographs that we're going to show. We've got some great pictures that Dr. Mobley sent in, and you're going to tell us what these are of. It's of a woman that you performed breast surgery on, and you also performed liposuction and tummy tuck. So what are we seeing here?
This is a before and after of her abdominoplasty, and you can see she is a darker skinned patient. She's actually Indian. And so she has a fairly dark scar, but you can see the dramatic improvement in her contour from before to after. And that scar falls under anything you would wear, like underwear or bathing suits. And it will lighten up quite a bit over time. So although it's dark on her because of her more pigmented skin, it does tend to fade and become less noticeable over time.
Yes, and also, as you mentioned, the scar is going to fade a little bit, which is a wonderful thing.
Right, right. And that can happen over many years, so it gets better and better.
All right, our phone lines are open, and we'd love to hear from you while Dr. Mobley is describing what we're seeing here. And the phone number is 361-4675. That's 361-4675. Okay, we have a before and after of breasts here. Tell us what we're seeing.
Okay, the same patient, she had this on the same day, along with some liposuction. So she had a very classic mommy makeover. And she had very large breasts that drooped and were very difficult to deal with because of the size and the shoulder strap gouging and difficulty with dressing and performing normal activities. So you can see on the after picture, they're much smaller. Obviously with the nipple area blurred out, it's a little hard to see the true improvement, but she had quite a dramatic change when you take into account her tummy tuck and her breast reduction, and it really was a change in her whole life, from then on. We
blurred those out because of modesty, just because, we certainly want people to be able to see absolutely what you've done. But I was able to see the pictures before we went ahead and did that. And it was dramatic because it almost looked like her nipples, which were down here, all of a sudden you picked them up and put them where they were supposed to be, which is great. Right, and it can be such a fundamental improvement in the body image of a patient, and especially somebody who's gone through the difficulty of childbirth and raising children, to have that sort of get back to the body where they think of themselves, where they thought of themselves as before pregnancy. It gives them back not only a self-esteem, but sort of that image of being attractive in their clothing, and it gives them the ability to get back to the sports activities that they did before, things like that. But I would imagine that it's not just for women whose breasts have become enlarged due to pregnancy, but large-busted women have that problem where their breasts, as each year goes by, they lose elasticity and they get stretch marks, and no matter what, if you have very large breasts, and breasts are made of fat, is that correct?
Fat and some breast tissue also. But yeah, I would say my happiest group of patients by far are breast reduction patients, because they've lived through years of having neck pain and back pain and shoulder strap gouging and rashes underneath their breasts and all these symptoms, and then suddenly one day those are all gone and they can find clothing more easily, they can get back to sporting activities, they can exercise, and I'll see them commonly lose weight after a breast reduction because for the first time in years they can do the things that they really want to do. So it can be a true life-changing surgery. So it's an exciting one for us because we can see those changes in the patient and how they think of themselves from before to after. It's really neat.
Well, the pictures are really dramatic. I'm sure that lady was very happy. And of course, if somebody wants to come in, is the next thing to do for someone to call up and get a consultation?
Yeah, I think the best first step is to call our office and talk to Cheyenne and say you're interested in just being evaluated for these procedures. And again, there's no commitment on the part of the person coming in. It's just a matter of if you're interested, we want to talk to you and explain them to you and tell you what those procedures are and if you're a good candidate.
All right, we'd like to thank Dr. David Mobley again for being with us on Local Doctors on Call, and thank you for taking valuable time out of your day for your phone calls and to watch us. Don't forget, Local Doctors on Call on Facebook. Press the like button. Follow me on Twitter, Alex Redmond. We'll see you next time. Remember, it's your health.